Good night to all of you. I'm going to talk about the elevator speech on the role of nurse practitioner. What is a nurse practitioner? According to Carrier, a nurse practitioner is a clinical leader with a readiness and an obligation to advocate for the client based on their professional at the system level of healthcare. The nurse practitioner provides the basis for development of educational and practice competency. Joel stated that a nurse practitioner has been developing their medical services by providing services to uninsured immigrants or low-income individuals, to people who ask for medical services in a walk-in clinics, to people who are attending community-centered offices, to child abuse patients, or participating in immunization programs. Other roles include care in long-term facilities, nursing homes, and rehabilitation centers due to chronic health needs. At last, nurse practitioner will provide services to mental health cases or women in health. So currently, ICN gives the following definition. A registered nurse has acquired the expertise, knowledge base, a complex decision-making skills, and clinical competencies for expanded practice, the characteristics of which are shaped by the context and or the country in which she or he is credentialed to practice. A master's degree is recommended for entry-level school. That is according to Schubert. How does a nurse practitioner differ from a physician assistant? In the article from South Shore Orthopedics, they explain that the term nurse practitioner is a registered nurse with advanced education and clinical training. A physician assistant is a medical professional with advanced education who is trained in the same way as a physician are. The physician assistant is educated as a master level degree. They also have professional experience in or related to the medical field. While the nurse practitioner also complete at least master level degree. They must have to have an active registered nurse license plus more advanced training in clinical experience. How does a nurse practitioner differ from a physician? There is one vital difference between nurse practitioners and physicians, which is the duties of nurse practitioners revolves around providing patient primary care, whereas the duties of physician encompass complex patient diagnosis, specialty in care, and treatments. Another difference between nurse practitioners and physicians is that physicians undergo more training hours than nurse practitioners, so their responsibilities differ. Some of the responsibilities of nurse practitioners include recording patient medical histories and performing physical exams, administering primary and emergency care to patients, creating patient treatment plans, prescribing medications and monitoring patient progress, ordering and administering diagnostic tests, and educating the patient. Why don't you just become a physician? To become a physician, you must have a background from a bachelor degree that fit with that discipline. It is difficult to enter the School of Medicine due to the number of young people who apply to become physicians. In my case, age is something that is an important factor. The period needed to become a nurse practitioner is around 3 to 4 years, depending on the school and the program. While to become physician is 6 years plus 1 to 3 years of specialty. As you are becoming nurse practitioner, you can work as a registered nurse as you are attending a school. But if you are studying to become physician, there is no chance to work. It is a full-time at school. There are more limitations to be accepted in a medical school due to the requirements. It has more accessibility to enter a nurse practitioner program. A registered nurse has a different approach. The experience, the one-on-one practice with the patient helps to understand the patient per se. So thank you very much, and I hope that you understand the difference between the nurse practitioner, a physician, and a physician assistant. Thank you. Have a good night.